Bile duct strictures are a complex and challenging condition that affects the biliary system. In this comprehensive script, we will delve into various aspects of bile duct strictures, including their anatomy, physiology, etiologies, clinical presentation, diagnosis, imaging modalities, classification systems, and differential diagnosis. We will also explore the management options, complications, prognosis, and ethical considerations associated with bile duct strictures. Furthermore, we will discuss emerging therapies, follow-up, surveillance, and advanced topics such as primary sclerosing cholangitis, PSC, benign versus malignant strictures, interventional radiology techniques, long-term outcomes, and genetic factors. By the end of this script, you will have gained a thorough understanding of the complexities surrounding bile duct strictures and the multidisciplinary approach required for their management. Bile duct strictures occur when the ducts responsible for transporting bile become narrowed or blocked. This can be caused by various factors, such as trauma, surgery, pancreatic inflammation, or cancer. Identifying the cause is important for effective treatment. The clinical presentation of bile duct strictures may vary depending on the severity and duration of the obstruction. Patients often present with jaundice, pruritus, itching, dark urine, pale stools, and right upper quadrant abdominal pain. These symptoms can be attributed to the accumulation of bilirubin in the bloodstream and subsequent bile duct blockage. To diagnose bile duct strictures, a thorough clinical evaluation is necessary. The initial step involves obtaining a detailed medical history and performing a physical examination. Laboratory investigations, including liver function tests, complete blood count, and tumor markers, can provide valuable information. Imaging modalities such as ultrasound, magnetic resonance cholangiopancreatography, MRCP, endoscopic retrograde cholangiopancreatography, ERCP, and percutaneous transhepatic cholangiography, PTC, are crucial for visualizing the biliary system and identifying strictures. Ultrasound is commonly used as a first-line imaging modality for evaluating bile duct strictures. MRCP utilizes MRI to provide detailed anatomical information, while ERCP enables direct visualization and therapeutic interventions. PTC is reserved for cases when ERCP is not feasible, offering excellent visualization but with higher risks. Classification and grading systems provide a standardized way to diagnose and manage bile duct strictures. They help determine the severity, extent, and complexity of strictures, guiding treatment decisions and predicting outcomes. Several systems exist, categorizing strictures based on location, pattern, and complexity. Grading systems further stratify strictures based on factors like proximal duct involvement and associated vascular involvement. These systems aid in choosing the best treatment approach and providing prognostic information. When evaluating suspected bile duct strictures, it is important to consider other conditions like cholecystolithiasis, cholangiocarcinoma, and pancreatic malignancies. Differentiating between them is crucial for appropriate management and relies on a comprehensive evaluation. The management of bile duct strictures requires a collaborative approach involving gastroenterologists, surgeons, radiologists, and oncologists. Treatment options include endoscopic interventions, surgical procedures, and interventional radiology techniques, tailored to each patient's individual needs and condition. Bile duct strictures can cause complications like cholangitis, liver abscesses, and secondary biliary cirrhosis. Prompt treatment is necessary to prevent further problems and improve patient outcomes. Monitoring for long-term complications is important. Prognosis varies depending on the situation. Given the complex nature of bile duct strictures, a multidisciplinary approach is essential for providing optimal care. Gastroenterologists, hepatobiliary surgeons, interventional radiologists, pathologists, radiologists, and oncologists collaborate to ensure accurate diagnosis, appropriate management, and comprehensive follow-up. Multidisciplinary team, MDT, meetings play a pivotal role in these patients' care. These meetings involve expert discussions on challenging cases, including imaging review, pathology interpretation, and treatment planning. Shared decision-making among the team members ensures a coordinated and individualized approach to each patient. Regular MDT meetings also contribute to ongoing research efforts, quality improvement initiatives, and the development of clinical guidelines. By working together, healthcare professionals can enhance patient outcomes and optimize the management of bile duct strictures. Advancements in technology have introduced new treatments for bile duct strictures. Innovations like special stents, balloon dilatation, and minimally invasive approaches show promise in improving outcomes. Ongoing research is needed to determine their effectiveness and ensure proper patient selection and follow-up. Proper follow-up and surveillance play a crucial role in detecting disease recurrence, managing complications, and ensuring long-term patient well-being. Post-treatment surveillance typically involves regular clinical assessments, laboratory investigations, and imaging studies. The frequency and duration of follow-up depend on factors such as the underlying etiology, treatment modality, and patient response. Close monitoring is essential to identify early signs of stricture recurrence, stent dysfunction, stone formation, or malignant transformation. Furthermore, surveillance allows for the timely intervention in case of complications such as bile leaks, stent migration, or recurrent infections. Multidisciplinary care, involving gastroenterologists, hepatobiliary surgeons, and radiologists, ensures comprehensive post-treatment surveillance and timely intervention when required. Ethical considerations are important in managing bile duct strictures. Shared decision-making, effective communication, and balancing risks and benefits are essential. Ethical dilemmas arise when invasive interventions may affect prognosis and quality of life. A patient-centric approach guided by ethical principles is paramount. In summary, understanding bile duct strictures in the context of PSC is crucial for accurate diagnosis and optimal treatment. Differentiating benign from malignant strictures using imaging and invasive techniques is essential. Interventional radiology offers less invasive options for advanced cases. Long-term outcomes are influenced by various factors, and genetic factors play a significant role in the pathogenesis. In conclusion, bile duct strictures are complex conditions that require a comprehensive understanding for accurate diagnosis and optimal treatment. Collaboration, research, and knowledge dissemination are essential for improving patient care and outcomes.